So, is it unethical to treat a family member when you are a physician? So, this is actually not a black and white thing, and it's a nuanced discussion. So, unfortunately, when doctors out there in the world treat their family members and friends, they're often treating them for medical problems that they don't typically treat in their general practice. So they're doing favors for people, right? So you have a friend that has a UTI, you don't normally treat UTIs, and you call them in antibiotics, but you also didn't examine them, do the proper testing, and document. So you can see where it gets a little bit weird. So you're not doing things in the proper way that you would if it was a patient in your office. So here's kind of an example of what I think would not be appropriate. So I have kids. If my kid had abdominal pain and an earache, and I just decided that I was going to prescribe antibiotics for my kid, just be done with it. Or if my kid needed a physical for their school to clear them to go into whatever grade, and I just filled the form out and sent it in. I don't think it's appropriate. I'm not a pediatrician. They deserve proper care like every other patient, and I should want that for them, right, as a doctor. But you can see how it gets a little easy to bend the rules to save yourself fuss and time. So you never can make decisions as a doctor for your friends and family to save time and fuss. You want them to get the same treatment that every patient should get. Now, if my child, say, had a mole that needed to be removed, totally comfortable removing a mole on my child. I don't think that's unethical at all, and I don't think anybody would think that was unethical. Within my scope of practice, completely appropriate. I would do it properly, though. I would do it in my office. I would do it properly. I would send pathology, document in the chart. So you can see how those two things are different. I'm staying within my scope. I'm doing a small, non-life-threatening procedure, and I'm documenting and behaving just as I would if it was someone else's kid that came into my office for a mole removal. The other situation with the school physical or treating earaches, I don't do that. So it would be weird for me to just start doing that on my kids. It's wrong. Now, say a friend or family member has some major life-altering, life-threatening problem like cancer, and they were coming to you for an emergency heart surgery, or you were a trauma surgeon, or you were an oncologist prescribing them chemotherapy. There's some concern that your personal relationship may alter your judgment with how you care for them. And that's certainly more of a problem with high-intensity problems like life-threatening problems, where it's less of a problem with low-intensity problems and non-life-threatening problems. And when it comes to cosmetic surgery on a spouse in particular, you can see where your personal relationship may affect your judgment, right? And so you just don't want to get in a situation where you're making surgical decisions that are being affected by your personal relationship with your spouse. And I think you also have to consider that people have complications and problems. Sometimes they don't end up as you anticipate, and you're sleeping in a bed with them. Seems like not a good situation for anyone. And then the last thing I'll add is that you just want to be careful with controlled substances for obvious reasons. So I think one of the most common things that I personally get asked is friends or family member will shoot me a text and say, hey, I twisted my ankle. Can I have some Norco? Hey, I'm flying to Europe. Can you prescribe me a Xanax to sleep? Things like that. That's just bad. Don't do that ever for anyone. That's just bad to do. And don't ask your doctor, nurse practitioner, and PA friends to do that either. That's not good. So please don't do that. But those are kind of some various scenarios. So as you can see, it's nuanced. There's different situations, and you just have to do what you're comfortable with as a physician. But I think, again, the way that I think about it is is this a patient I would see in my office normally? When I come in to consult, would this be a consult I see on my schedule? Would this be a patient I would typically take care of? And I think, a lot of the time with friends and family members, the answer to that question is no.